Patients who are interested in breast revision surgery vary. Some women have had a breast reduction and are not satisfied with the weight gain, have increased the breast volume, and just feel a little bit more top-heavy again. That's a spectrum of breast revision. More commonly, it's associated to an implant. Usually, there's some implant-related revision that patients are interested in. Either it's one of the more common indications for revision associated implants is, I want to go bigger. I want a bigger implant. Very, very common. That's a pretty straightforward surgery. To more of a complication associated to the scarring phenomenon around an implant, like when the scar gets a little bit too thick, it's called encapsulation or capsule contracture. That's an indication for revision where the scar is cleaned out, the implant is changed out, and there can be an adjustment made in the pocket placement, sometimes completely changed. So every patient's revision need who are interested in revision surgery to improve the shape and appearance or volume is very unique to each patient. It could be one side, it could be both sides. It could be things that need to be completely redone. The complexity dramatically increases with every revision surgery. So patients who've had 4 or 5 surgeries already, doing that 6th surgery for whatever reason, it's exponentially more difficult to correct or to improve. So patients who are interested in revision surgery should really take the time and do the research. Interview, sit down with a couple surgeons, get a couple opinions. How can I make this better? And this will be it. This will last me a very long time. Because breast revision surgery can easily become more complicated and get out of control as far as complications. If you're trying to chase this perfection and have a perfect shape, sometimes there's just limits of what can be done in the face of what has historically been done with the breast. So the idea is to do these safely and to avoid these disastrous complications, losing implants, losing skin. These things we feel that are not worth sometimes another revision surgery to go down that path of another surgery that has such a high complication rate. So it needs to be focused on safety and setting realistic expectations of what I should expect from a surgical outcome of a revision surgery.